We had a very small hospital before. Now what you see of the hospital is double the size at what it used to be.
Back then, there was not much renovation, but now we've got this massive unit.
Well, firstly, the building has improved on the outside. The facade is very attractive. And it's not only beautiful on the outside, it's beautiful on the inside. And many of my clients come in and say, this is really beautiful. But the most important thing, as I said at the beginning, is the easy access to the necessary centers like the admission office and the pharmacy and the radiology and all of that, easy to access.
With my love for babies, all this equipment that we have currently makes it easy for me to provide holistic care to the babies that we possibly can. When we nurse these babies, we treat them as our own. But now moving to the new unit, it's big, it's open, it's spacious, it's got individualized rooms for the extreme low birth weight babies, whereby the mummies or the daddies can even kangaroo their babies. The state-of-the-art equipment that we have, they make it easy for us to actually view all the babies in the unit from a centralized monitor.
Well, this is a kind of a breath of fresh air. We can help more patients because of the increased number of ICU beds, any increased number of ventilators for patients who need ventilators. We can provide for certain patients who need renal replacement therapy, because of the space and the setup, we can provide these services.
Now we have a fully fledged pediatric ICU, which we didn't have before. Our neonatal ICU has expanded. We've got an increased number of beds than we used to have. And neonatal ICU is just above pediatric ICU on the 3rd floor. Our pediatric ward for general pediatrics has also increased to a 37-bedded unit, whereas before we had about 20 beds in our pediatric unit.
So right now we are able to help a lot more patients. Our unit has got 2 emergency beds, it's got 5 basic beds, the general beds, and also we've got 1 isolation bed right here and a pediatric bed. When a patient comes in, they can quickly be taken to a bed, as compared to previously where patients had to wait for a bed. Now I can say we are a fully functional emergency unit.